Right, so today is the 14th of September and I have just reached the hospital in Bury St Edmunds where I'm going to have my operation. Today I've just got an appointment for some pre-assessments, blood tests. I think I have to have an ECG because I had a heart episode a few years ago. We will see. The weather is beautiful. No, it's absolutely pouring down with rain. Driven for an hour and a half and it's been bloody awful weather. Where's the sunshine gone? Anyway, I'm now about to go in and I will see what I have to have done and then I will do another update. Okay, thank you for listening. So I went for my assessment at the hospital yesterday and I got on really well. Basically, they just want to know that you're fit and well to have your operation and that you are at no risk with having a general anaesthetic. I asked to have a general anaesthetic as opposed to a spinal block because, well, for one thing, my consultant actually said it's the better choice anyway, but I really do not want to know what's going on when I'm under at all. I don't want to hear anything. Just don't want to know. I just want to be put out. So I had a blood test. I had my blood pressure taken and more x-rays, yeah, just to see the state of the hip at the moment because I think it was November my last x-ray. So they run through your whole medical history, lots and lots of questions, and that all went absolutely fine. The process took about an hour. And then they gave me some literature to read. Obviously with COVID, very much here at the moment. There are extra precautions that they take. So I have to go and have a COVID test 3 days before the operation and then I have to self-isolate. The literature that they gave me, hang on a minute, I'm not going to show you, but there is included a two-step guide to having a whole hip replacement that I started to look at and thought, I'd rather not know. I'm really not sure I want to know exactly what they're doing. Everyone's different. When I have a blood test or I am a blood donor, I always look away when they're doing it because I don't want to know. Don't want to see anything being done. And I'd rather not know exactly what they're going to do with this operation because I'm nervous about the op enough to not want to know the grisly details of it. They did explain the recovery process to me. Basically, when I have the operation, it's going to take roughly about 3.5 hours. I will go back to they'll take me back to my room to recover from the anaesthetic, and then 4 hours later, I will be up out of my bed with a physio. Yeah, 4 hours after the op. I was a bit taken aback at that, but they like to get you up as quickly as possible. There are certain things you can't do. You're not allowed to bend in any way because obviously whatever's inside needs to stay put. But yeah, apparently the physios there are quite strict about getting you up and moving. They explained that I will be having disposable stitches inside and glue on the outside, so I don't have to sort of go back and have any stitches taken out after, you know, the period, 6 weeks or whatever, recovery. So going back to recovery, yeah, I'm up out of my bed after 4 hours. That will get me up and about every few hours to walk around. I have to practice going up and down the stairs. They've got kind of pretend stairs that they bring. And if everything's fine, if my recovery from the actual general anaesthetic's okay, I can go home 3 days after the operation. So it's quite quick. But you really want to be in your own bed anyway, don't you? You don't really want to be in a hospital bed. So 3 days before the operation, I have to wash my hair and my body with Actenisan. So basically 3 days before, you on a daily basis wash your hair, your body. There is a swab here for up your nose, and it just helps to prevent you contracting MRSA while in hospital. You can use a body lotion afterwards because apparently that's quite astringent. I have eczema on my hands now from using hand sanitizer a lot. God knows what that's going to do to my body. Yeah, this, put it in your hair as well. I've got to wash my hair in it, but apparently I can use conditioner afterwards. Yeah, okay. This is going to be interesting. It's a bit like sterilising myself on a daily basis, but if it does prevent MRSA, then yeah, of course we all must do what we must do. And that's just about it. I was in the car for an hour and a half travelling down to the hospital yesterday, and I must say that when I got out of the car I could hardly walk. I feel like my hip now is getting worse daily. I've got the hour and a half drive back home afterwards, and I really did suffer last night with it. Quite honestly, I think if I'd had to wait much longer, I probably wouldn't be walking at all by this time next year, which is worrying, really worrying. But anyway, I'm getting it done now, and hopefully afterwards I'll be a lot more mobile than I am. But it's tough having a hip condition. It really saps the life out of you. Things that you could do before easily, you struggle with. I struggle going up the stairs now. It hurts. I can't get in and out of the car without it really, really hurting. That's just the start of it. It takes over your life. You actually, when I know that I've got to go up the stairs, I think, oh God. Whereas before I used to run up the stairs, run down the stairs. And when I'm getting in and out of the car now, I'm just, it's awful. Unless you've been in that kind of pain, unless you've had that kind of limitation, it's really hard to describe to people. It's just horrible. So although I'm really, really nervous about the operation, I can't wait to be mobile again. Funny enough, the one thing I was really nervous about that I spoke to them about yesterday, I have this phobia that I'm going to wake up in the middle of the operation and hear and see everything they're doing, and it's irrational, it's stupid, but I can't get it out of my head. And I actually said that to the nurse yesterday. So I have a phobia about waking up, and she said there are so many protocols in place, Hannah, you don't need to worry. We will make sure you're really asleep before we even start on you. And yeah, it's just, I know it's a really, really stupid thing, but I think I've been watching too many horror films. But yeah, anyway, I will do another update in a few days, and then hopefully my next update after that will be when I'm admitted on the 8th of October. So thank you for watching, and I will speak soon.